Good afternoon, everyone, and welcome to this roundtable discussion with the House Democratic Caucus in partnership with my tremendous colleagues in government, Congresswoman HAALAND, Congresswoman Davids, Congresswoman Craig, as well as Congresswoman GWEN Moore, incredible champions for Indian country and for the districts that they represent throughout the United States of America. This is a very challenging time for us here in this country as we grapple with the COVID-19 pandemic, both a public health crisis and an economic crisis. And it has brought a lot of pain, suffering, and death to the American people. But we know that certain communities have been impacted more adversely. And that has clearly been the case with respect to Indian country, who have disproportionately suffered the adverse consequences of both the public health crisis and the economic crisis. And we have an obligation, both related to our treaties, our trust, and in the best interests of doing the right thing in this nation, that we provide the resources necessary for those in Indian country to meet the challenges that have been brought about by the COVID-19 pandemic. And we are committed to making sure that the data drives the resources. And we know that the data says to us that Indian country has been disproportionately and adversely impacted. And we need to work together collectively to address the lack of housing opportunities, economic opportunities, educational opportunities, as well as the healthcare disparities that continue to plague Indian country. We know that Indian country is incredibly resilient. That is a hallmark of the journey that you have been on as the first citizens. And we want to support that resiliency as we address the needs of Indian country in the context of this devastating pandemic. So I welcome all of our distinguished guests and leaders. Look forward to the dialogue and discussion, and most importantly, look forward to working together so we can meet the needs of Indian country for such a time as this. And now it's my honor to yield to my distinguished colleague from the great state of New Mexico, Deb Haaland.
Hello, everyone, and thank you, Chairman Jeffrey, so much for all your work to pull this roundtable together to highlight the issues impacting Indian country. This Congress, I have been working hard through my individual capacity and as co-chair of the Congressional Native American Caucus to help highlight long-standing issues for tribes so we can find solutions for those who need it most. I would like to say a big thank you to my colleagues on the call today for supporting my efforts, especially during the COVID-19 pandemic that hit tribal communities at disproportional rates, especially in New Mexico. Without your help, we wouldn't have been successful to include the desperately needed $8 billion of corona relief funds that was included under the CARES Act for economic relief on tribal lands. I'm deeply appreciative of everyone's efforts to help move this forward. I don't want to take up too much of everyone's time here today, but I'd like to highlight just a few pieces of upcoming legislation that I'm working to introduce before the end of this Congress. The first one is called the Truth and Healing Commission on Indian Boarding School Policy Act, which will be the first bill to establish a federal commission to formally investigate and document the assimilation practices and human rights violations of the boarding schools to address and heal the intergenerational trauma that our families have experienced through the decades. The second bill is called the Broadband for All Resolution of 2020 to recognize affordable broadband as a human and civil right for all Americans, including Native Americans. This mirrors the language of a United Nations resolution that was adopted by 70 countries, since lack of access to broadband primarily has impacted people of color and folks with income levels below the federal poverty level. I will introduce both of these bills within the next several weeks and would love to have any support that you can provide for their introduction. Please don't hesitate to contact my office for additional information. And at this time, I am so honored and proud to introduce my dear friend and my colleague, Congresswoman GWEN Moore of Wisconsin.
Thank you so much, Deb HAALAND. You have truly been a fantastic partner in protecting sovereignty, and I hope that today's conversation will elevate and lift it so that we can continue to work forward. I'm grateful to be in attendance for this important roundtable for examining the economic and healthcare impacts of the pandemic on Indian country. Now, there's clearly a connection between the health of a community and the economic gains. I mean, they happen in tandem. And this pandemic has exposed and lifted up the gross health inequities in communities of color, and not least in Indian country. And although, and so one area that I have really been working on in the Ways and Means Committee to address this long-standing vacancy rates of caretakers and healthcare providers in Indian country, and wondering why that is such a challenge. We've had trust and treaty obligations the United States has to promote healthcare services to American Indians and to eliminate the health disparities, and the responsibility falls to the Indian Health Services. But what I found out, Indian Health Services mission has a mandate to serve over 2 million Native Americans, but it's been hobbled by funding shortfalls, which account for high vacancy rates and turnovers for doctors. To recruit and retain health professionals, the Indian Health Services provides scholarships and offers loan repayment assistance. But Indian Health Services scholarships and loan repayment assistance don't benefit from exemptions like those enjoyed by the National Health Service Corps scholarships and loan repayment programs, which are interest-free. So I think that those tax exemptions would be an important tool to help address, at least on a long-term basis, these workforce shortages and create equities with regard for the scholarships that Native Americans are eligible for. And that's why I've introduced the Indian Health Services Health Professions Tax Fairness Act with Congressman Cole in the House as a Republican co-sponsor. This bill would increase the availability of healthcare services to Native Americans as a longer-term solution to be able to recruit people to provide services to Indian country. American Indian students enter college and medical school with higher degrees of debt and less family contributions available to them so that they can exit graduate school and medical school programs with higher degrees and they leave with higher degrees of debt. So having this heavy debt load limits all of their career choices in the future as well. So this bill would incentivize them to pursue higher education. Something else that's important to keep in mind is that the importance of exposing students to Indian country and communities of color more broadly to career opportunities, because many of them just simply don't have the social capital and the social networks. The importance of exposure is in the headlines again when Vice President Biden picked Senator Kamala Harris to be his running mate in the upcoming election. Being able to just look at someone who looks like you, whether woman, Black, Native American, Asian, or and other distinguishing characteristics about you, it's a powerful, motivating, inspiring so many young people. And we need to build that pipeline so we can lift generations to come. So I just want to start with this small measure of making sure that Indian Health Services scholarships and loan programs have equities and that they're tax exempt, just like the National Health Services Corps scholarships. You know, but moving on from that, I just want to say that safe and secure housing is also a health issue. And we've asked people to shelter in place here, but Nahasda is still stalled. But still, getting housing in Indian country is really imperative. Overcrowding housing is part of the epidemic, and and transmissions of the COVID virus is just fosters. It's a breeding ground not to have adequate space and housing. So during the CARES Act negotiations, the last hangup was CARES funding to tribes. Of course, the GOP wanted to give zero tribes to them. Now, tribes had asked for 20 billion, and CARES had just 8 billion. This is just controversial. I mean, surely we can find a number between 20 billion and zero to help a Native American in Congress meet its trust obligations to tribe. And there's no better test of this than supporting tribes during a pandemic, which means financial support as well as honoring sovereignty so that lockdowns are honored. In South Dakota, the governor was challenging the Sioux on the lockdown of roads during the reservations. So moving on, I have the distinct pleasure of introducing Governor CHAVARRIA. Now, before he was governor, he was a forest manager, which really came in handy because these wildfires in 2011 burned 80% of the reservation, which is still recovering and has led to some floods due to the lack of trees and forestation. So the governor has made Santa Clara a vanguard of implementing coordinated disaster responses to disaster. He was also the president of the El Pueblo Council of Governors, representing 20 pueblos. Thank you again, Chairman Jeffries, for inviting me to participate today in this roundtable with these distinguished invitees. And so I'm honored to introduce Governor CHAVARRIA and to share his insight into the challenges Indian country is facing right now. So he's been the governor of Pueblo of Santa Clara, a tribal government since 2006. He's the chairman for the 8 Northern Indian Pueblos Council, the vice chairman for the All Pueblo Council of Governors. These leadership roles and his work on protecting Pueblo lands, resources, and the environment provide him with, I think, a unique vantage point that we can all benefit from hearing. So it's great. I can't wait until we can meet again personally, because the governor invited me to go to Santa Fe Indian Market, and I went there with him, and we took some pictures with him. And so well, he went with my chief of staff, and my chief of staff decided to propose to his girlfriend of many years there. So there must be something good happening there, Governor. And so with that, I'll turn it over to you.
Well, thank you for that, Representative Moore. And yes, good afternoon. My name is Michael CHAVARRIA, and I serve as governor for Santa Clara Pueblo here in New Mexico, to include the chairman of the All Pueblo Council of Governors here in New Mexico. So I appreciate the members of the House Democratic Caucus for inviting me to this very important session today. As mentioned, the COVID-19 relief bill served an essential role in fulfilling the federal government's just responsibility to Indian tribes by ensuring the interests of tribal nations, pueblos, and communities are accounted for during a time of unprecedented need. Legal duty to ensure that tribal interests are protected during any action, program, or policy undertaken by the federal government, including the development of pandemic response legislation. So it is very critical. Planning for the long term to address the current pandemic for many months and even years to come is critical. This is especially true for Pueblo nations here in New Mexico, with economic and health disparities have become exacerbated by the pandemic. In addition to reoccurring outbreaks of COVID-19, we need to prepare in advance for the future epidemics and pandemics. Regrettably, the medical response to the pandemic in public country has primarily been in a reactive rather than proactive manner, which is unacceptable. The Indian health system must be fully equipped with the necessary resources, supplies, healthcare infrastructure to proactively deal with COVID-19, the seasonal flu, and other healthcare conditions. So my question is, we request that congressional healthcare appropriations intended as tribal set-asides or for the Indian health system be processed directly through the Indian Health Service, or in its alternative, that administrative agencies be directed to work closely with IHS on developing a funding distribution methodologies and implementation processes that work in Indian country. We also urge Congress to direct the HHS to streamline to the maximum extent possible recording requirements across federal opportunities targeting tribes. These funds should be provided with the greatest flexibility to ensure that tribes can target the use of those funds to best meet our public's needs. The Special Diabetes Program for Indians has demonstrated success in providing diabetes-related care and reducing the incidence rates of the disease in our public communities. Access to the Special Diabetes Program is all the more vital today in light of scientific studies that show diabetes is one of the top underlying health conditions that contribute to the severe COVID-19 cases and increased rates of patient mortality, a high risk for public people. So we ask Congress support for long-term Special Diabetes Program reauthorization, which is key to program stability and sustained access to these essential services for our public people. We seek at least a 5-year reauthorization of the Special Diabetes Program with a self-governance funding mechanism option to coincide with the next Special Diabetes Program grant cycle. So I know 3 minutes is not enough time to fully address the many issues as it relates to the challenges as faced here in public country through COVID-19. If permissible, I do have about an 8-page briefing document that I can submit for the record. So again, thank you for the time today.
Thank you so much, Governor. And I agree, 3 minutes isn't long enough, but I hope you know that our doors are always open to you. So please don't hesitate to reach out to us, to send anything you need to our staff. And I think I can speak for all of my colleagues who are here today. We're always ready to help and ready to fight for what Indian country needs. Certainly for a long-term special diabetes program, absolutely. I am going to now introduce my dear friend and colleague, Representative Angie Craig, and she will then introduce our next speaker. And I am so proud to serve with Angie, and one of these days I'm gonna visit her in Minnesota. But happy to have you here, Angie, and happy to hear your remarks and your introduction.
Well, thank you so much, Representative Haaland. You've certainly been to my congressional district. So thank you for yielding and allowing me to introduce the National Congress of American Indians President Fawn Sharp. I'm proud to represent 2 federally recognized tribal nations, the Prairie Island Indian Community and Shakopee, Mdewakanton Sioux Community, which are part of a strong community of tribal nations located throughout Minnesota. Prairie Island is located in southeastern Minnesota along the banks of the Mississippi River. There are over 1,000 tribal members living on and off the reservation. The community has historically employed more than 1,700 people in its gaming, government, and business operations, and is the largest employer in one of my congressional district counties, Goodhue County. Shakopee is located southwest of Minneapolis and St. Paul, within parts of the cities of Prior Lake and Shakopee in Scott County, Minnesota. Shakopee's combined enterprises are the largest employer in Scott County. Both Shakopee and Prairie Island declared states of emergency in mid-March in response to the COVID-19 pandemic and announced a series of actions intended to protect the health and safety of tribal members and their guests, including closing down their tribal gaming operations until a time each deemed was safe to reopen. I've worked closely with both tribal communities and continue to do so since that time as an advocate for federal assistance, and have looked to the National Congress of American Indians as well as for guidance and leadership. So I am very, very proud to be here at this roundtable today and to be asked to introduce NCAI President Fawn Sharp, who is the third woman to hold the position of president and was elected last fall at the 76th Annual Convention and Marketplace. She's the current president of the Quinault Indian Nation in Washington and has a long history of serving in numerous leadership and legal positions to help her own tribal nation and the wider tribal community thrive. As a member of Congress, I have valued her input on how best we should be responding to the COVID-19 pandemic, while upholding our treaty obligations and ensuring the Indian community is not left behind during this pandemic. With that, I would now like to turn it over to President Sharp for her remarks.
Thank you so much, Representative Craig, for both your words, your passion, and your leadership. We truly appreciate this opportunity. I would also like to thank Chairman Jeffries, our Native American Caucus co-chair HAALAND, and Vice Chair Davids, as well as Representatives Moore and O'Halloran. We truly appreciate this time. These points of engagement provide us hope during times that are certainly dark and uncertain. And it's a blessing to note that we have champions in Congress who not only want to listen to us, but are actively engaged in advancing critical legislation. So our hands are raised, Sioquil. My name is Fawn Sharp. I serve as president of the Quinault Indian Nation and president of the National Congress of American Indians, the oldest and largest organization serving the broad interests of tribal nations and communities. Tribal nations are on the front lines of this pandemic and struggling to protect the health, safety, and welfare of their communities as the number of COVID-19 cases continue to rise in Indian country. At times, tribal communities have had the highest per capita COVID-19 infection rate in the United States, yet they only receive 0.5% of the $2 trillion in aid provided in the CARES Act. Tribal nations' vulnerability to COVID-19 is a direct result of the chronic underfunding of the federal government's trust and treaty responsibilities to tribal nations. In December of 2018, the U.S. Commission on Civil Rights released a report entitled Broken Promises, Continuing Federal Funding Shortfall for Native Americans, which found that the federal programs continue to be underfunded. With regard to health, the commission found, one, as a result of the failure to honor the federal trust responsibilities, vast health disparities exist between Native Americans and other populations. And two, funding for tribal health is inequitable compared to other federal health spending and covers only a fraction of tribal health needs. The findings of the Civil Rights Commission 2 years ago is especially harrowing as Indian country combats a national emergency threatening tribal lives and livelihoods. The effects of COVID-19 have touched every sector of Indian country, from infrastructure to public safety and justice. It has also exacerbated the digital divide, which was impaired tribal access to relief, impeded telehealth delivery, and reduced educational opportunities for tribal youth. Today, to aid our representatives, I will provide a snapshot of the escalating effects of the pandemic in two areas. First, I will address the economic crisis. The pandemic has devastated tribal economies, resulting in lost revenue, which impairs tribal nations' ability to deliver governmental services such as child welfare and retain employment. Tribal governments are projected to lose over $20 billion in critical government revenue as a result of the closure of tribal enterprises during the pandemic. Presently, many tribal nations have been forced to lay off or reduce their workforces, which has increased economic insecurity and also affected their surrounding communities. Next, I will address the housing crisis. Tribal housing needs are rapidly increasing because the tribal communities experience overcrowded homes at 16%, roughly 8 times the national average. These inequities have exacerbated during the pandemic and threatened tribal health and lives as families have difficulty social distancing or quarantining in overcrowded housing. These two cases and crises are just a sampling of the increasing impacts of COVID-19. To address these emergencies and the increasing need, Indian Country has requested that the next response package retain the tribal provisions in the HEROES Act and address additional unmet critical relief that's needed. Those provisions are contained in a July 20th, 2020 letter signed by over 15 tribal organizations representing over 574 tribal nations. In closing, I thank the members of the House Democratic Caucus and the House Native American Caucus for their strong advocacy in Indian Country, and I look forward to this conversation. Siakwil.
Thank you so much, President Sharp. As always, your passion and your experience and everything that you do comes through. And likewise, I want you to know that our doors are always open to you, and we look forward to all the information that you want to submit to us. I absolutely understand the needs, and I think they are the housing needs. Yes. The same around the country. And so thank you also. Thank you very much, President Sharp. Next, I am very honored to introduce my sister here in the United States Congress. There were 2 Native American women who were elected and sworn in on January 3rd, 2019. SHARICE Davids is a member of the Ho-Chunk Nation from Kansas, and very honored to introduce her now, and then she will introduce our next guest. Thank you.
Thank you so much, Deb, for the work you're doing. Also, I want to say thank you to Chairman Jeffries for organizing this discussion today about the impact and ongoing issues related to COVID-19. The pandemic is certainly having devastating impacts, and certainly that is true for Indian Country. And, you know, when we talk about the coronavirus relief funding and programs and recovery efforts, it's really, really essential. And we just heard this from FAWN Sharp. I appreciate the work that you're doing and the things that you were sharing about the impacts that we're seeing. Native voices have to be included in these discussions. And I think a lot of us know that it's for too long that Native communities have been ignored in moments of crisis, and that longstanding funding issues have certainly compounded the impacts and of crises just like this one. So, you know, the disproportionate impact that the Native community is feeling is twofold. It's the public health piece and it's the economic piece. And I know we were just hearing about that. Federal relief and assistance has certainly not been enough, and the delayed nature of some of that relief, the fragmented nature of some of that relief has been something that Congresswoman HAALAND and I have certainly been raising our voices about, and appreciate all of the tribal leaders and tribal communities who have been reaching out and raising their voices about it. And I do want to just kind of mention that as a member on the Small Business Committee, I want to focus on entrepreneurial and economic development challenges that Indian Country is facing right now. And, you know, throughout the pandemic, I've been pushing the SBA and Treasury to ensure that Native and tribally owned businesses have equal opportunities to receive the funding from federal aid and the programs that are out there, because you know, I know how important economic development is to ensuring that our Native communities can thrive. And so I want to I'm looking forward to hearing more about how we can better support Native communities as the health and economic crisis continues, and then discussing with other members of Congress how we can better respond to the needs of Indian country, because we have a real opportunity here to make sure that we're listening and that we're doing everything we can to properly, advocate for and push for the federal government to live up to its trust responsibilities. So I'm looking forward to continuing this, and then I'm very pleased to introduce Julian Brave NOISECAT, who's the Vice President for Policy and Strategy at Data for Progress, and the Narrative Change Director for the Natural History Museum, a fellow. He's a fellow of the Type Media Center and of Indian Collective, and his work has appeared in like the New York Times and the New Yorker and Rolling Stone, and so it's a great privilege to be able to turn it over. And I want to just also kind of acknowledge you grew up in Oakland, California.
Yeah.
And,
yes.
And I feel like I'm kind of excited to be able to introduce you today. I'll turn it over. And thank you for the work that you do, and for the just being a great voice and for Indian country.
Well, thank you so much. Wade Kuchechemk, to Representative Davids for the lovely introduction. Representative HAALAND, Chairman Jeffries, the House Democratic Caucus. Thank you all so much for your interest in my work and for having me today. I'm going to start my timer so that I stick to the 3 minutes. I've been reporting a number of stories about the pandemic in Indian country, including an article and video about the coronavirus on the Navajo Nation for the New Yorker, as well as a podcast about the census on the Mandan, Hidatsa, and Arikara Nation in North Dakota for Snap Judgment. My brief comments today draw from that reporting, and I would be happy to share my work with all of you when it's published. I can also share these comments in writing if that is useful. I want to emphasize two things, and that's firstly that the coronavirus has laid bare grave inequities that stretch from the foundation of this country and truthfully run straight through the treaties and appropriations requests that this United States Congress has repeatedly broken and denied. This Congress meaning historically this body, this legislature. Secondly, the pandemic and the current administration's actions have not only allowed the coronavirus to spread with deadly consequences in Indian country, but they've also fundamentally undermined essential government functions like the census. On the Navajo Nation, where about a third of homes don't have running water, a quarter are overcrowded, and a tenth lack electricity, creating conditions where people can't do things as simple as wash their hands, quarantine, and stock up on refrigerated groceries, the virus has rampaged through the population since March. When vulnerable Navajo contracted the virus, they were treated in hospitals and healthcare centers run or funded by the Indian Health Service, but the care they received there was often inferior to that offered elsewhere in the United States. Per capita expenditures for patients treated by IHS in 2017 were just over $4,000, compared to more than $13,000 for patients treated through Medicare. Since the 1980s, the IHS budget has failed even to keep pace with the growth of the Native American population. Nationwide, the agency has just 1,257 hospital beds to serve a tribal population of about 2.5 million. And by comparison, there are some 23,000 hospital beds for the 8.3 million residents of New York City, meaning there are about 360 New Yorkers for every hospital bed in the city and about 2,000 Native Americans for every hospital bed in Indian country. And on the Navajo Nation, when the pandemic hit, the reservation had just 28 ventilators for a population of more than 173,000. The Navajo Nation president, Jonathan Nez, told me, quote, "Native Americans and Navajo people are the first citizens of this country, and yet we are still treated as equal. We're still not treated as equal in the 21st century." I would add to President Nez's comments very briefly that we will not be counted by the federal government equally in 2020 either. I just returned from a reporting trip to the Mandan Hidatsa Nation last week, where the self-response rate for the census was 22.5%, which is just a third of the statewide response rate in North Dakota, and where the non-response follow-up process led by census enumerators has reached just a little over 10% of households. So in the middle of this pandemic, this administration moved up the deadline for the census enumerators a full month to the end of September, which is in like 15 days. And that's going to have enormous consequences for Indian country. In 2010, Native Americans were the most undercounted racial demographic in the country, with an estimated 4.9% not accounted for in the census. It appears highly likely that this time around, the undercount will be even greater. Very briefly, across Indian country, I've met Native people who know that we matter. I've met Navajo medicine people tending traditional gardens and moving their practices to a telehealth model in the middle of a pandemic. I've interviewed Navajo women providing mutual aid to families across the reservation, while I've met others who are using CARES Act funding to install rooftop solar on the homes most impacted by this pandemic. I've also met Native people who are moving our cultural celebrations like powwows online to Facebook. I've witnessed a former Miss Indian World working tirelessly to make sure everyone on her reservation is counted. And I've also listened to families mourning the losses of loved ones who kept working in Bureau of Indian Education schools when the pandemic hit. They all know, we all know that we matter. The question is, when will this administration and both chambers of this Congress, because I know that the House does know this, start acting like we matter? Thank you very much for the time.
Thank you all so much to all the guests and my colleagues for sharing their time and expertise today. We will now begin our member questions and remarks period. I would like to yield to Representative Moore. If Representative Gwen Moore is still here. There you
I am definitely still here, and I have really, as always learned something new is happening in Indian country, and always have things reinforced. I appreciated hearing from everyone, and in particular Julian, Brave, NOISECAT, and also FAWN. I was particularly struck by the discussion of the nexus between health care delayed and the vulnerability to COVID that comes as a result of that. And I visited native land to see some of the terrible deterioration that has happened with regard to housing and housing assets. One of the things that really concerns me is that the low-income housing tax credits, other instruments that are used to allocate resources to nonprofits and to local governments, those kinds of instruments, community development, financial institutions, somehow we are just not getting the formula right enough to be able to really do anything substantively in Indian country. And so I would just offer, as a question and as a conversation piece, what can we do specifically legislatively to try to get some equity and parity with regard to things like the low-income housing tax credit and CDFIs to address the housing crisis in Indian country?
Yes, so I'll go ahead and thank you for that question, because housing is a definite need in every community across this country. And you're absolutely right. Not only providing federal funding for low-income housing tax credits through our CDFIs, that's critically important. We're also finding that having an opportunity to meet the housing needs for a generation of young people, we struggle with finding housing, apartment housing, or just housing availability. It's challenging to provide it for entire families. But when we send our youth off to college and they go away and they want to come home, back to the reservation, there's no housing available. And so we often lose our best and brightest talent to neighboring communities simply because they cannot return home. And so from our perspective, if there could be targeted legislation that not only provides access to capital and other opportunities, but really look at the housing needs from our perspective. And from our perspective, that entire generation is being left out of the equation. And so I would offer that, because that's only going to be a long-term fix so that we can bring that incredible brain trust of our young people back home to help contribute and build our communities. But oftentimes in every housing conversation I've been engaged in, it's that generation that seems entirely left out.
Yes,
Thank you so much. Oh, you should go ahead.
Yeah.
I'll let my elder speak first.
All right, this is Governor CHAVARRIA from Santa Clara. So that's very important. You know, as I mentioned, in the longer term, all public council infrastructure has been very difficult, and we see the deficiencies in infrastructure during this time. Multiple generations living in one household. But again, I go back to President's comment, is that we tell our youth to go to college, get a good job, but yet they come back, then they're not eligible for homes, the low income homes. And so now in Santa Clara, we looked at the 184 loan guarantee to help them. But again, you have to have good credit. You have to have good information in order to qualify for that type of housing. And we do have apartments, but again, it's very important of how do we work together to figure out a strategy to make sure that we're not leaving out those individuals that may be overqualified income-wise, and not penalize them just because they're trying to make themselves and their household and their family in a better position to support themselves. So this is a very important topic as we move along regarding housing. So thank you for the time.
Yeah, thank you so much, Congresswoman. I'll keep my response very brief because I know there are other questions, but I'll just say that I did a good bit of reporting on the housing crisis in Indian country a couple of years ago. There's a really wonderful and also very troubling report by the Urban Institute that was put together at the tail end of the Obama administration that really outlines the depth and scale of the crisis in Indian country in terms of numbers. I believe it was something like 65,000 units across Indian country are needed. And when you also take into account the fact that 70% or somewhere north of 70% of Native people actually live in cities, where of course there are affordability issues, the problem might even be bigger than that. You know, I think that one thing to keep in mind is that of course the low-income housing tax credit is a tax credit. So when demand for it goes down after you pass something like the Trump tax cuts, that has cascading impacts for the communities that rely on that tax credit. So I think there are upstream. There are upstream things that can be done, like repealing tax breaks for billionaires and corporations that would benefit not just our society, but would also mean that there would probably be more demand for that tax credit, which would then go into our communities.
Good call. Thank you. I would yield to Chairman Jeffries, or back to you, Deb.
Thank you very much, Gwen. Very happy to have you here, and thank you all. I am going to yield now to Representative Angie Craig.
Well, thank you so much, Deb. And President Sharp, thank you so much for allowing me to introduce you. But I wanted to just direct my time to some of the testimony you provided Congress and ask the others to weigh in here, including the select subcommittee on the coronavirus crisis, where you laid out just how severely COVID-19 had disparately impacted American Indians. I wanted to have you focus more specifically on one section of that testimony that I've worked specifically with Perry Island and Shakopee on, the delays in federal funding that were specifically allocated by Congress for the COVID response. As you noted back in June, distribution of those funds were beset with delays, and you've called for an investigation. I certainly agree with you that that is warranted. I was wondering if you could expand upon, and I'd love to hear from Governor, you as well, or anyone, about how those delays harm tribal communities. And I wondered if there's any outstanding dollars yet to be distributed.
Yes, absolutely. And I appreciate that question as well. And to the last question, yes, there are still dollars that are being withheld, and not just a few dollars, significant dollars. And when we're coming up against a December 31st timeline to expend out those funds, tribal nations are forced to try to figure out how are we going to spend massive dollars in just a couple of months with an uncertainty as to whether or not we're going to be able to have anything beyond January. At this point, we have no idea how to plan. And we're also, realize that we could be facing the worst part of the pandemic in the fall and winter months. And to have little to no resources or any promise of resources beyond January 1 is a very scary proposition. And so not only does it impede our ability to provide services that we so desperately need right now, it also impairs our ability to plan out to provide added strength and resilience to our communities going into the worst possible time of this pandemic.
Thank you. Would anyone else, Governor, would you have anything to add there?
Yeah, this is very important, and it's been a critical what Council of Governors in New Mexico has been along because of the major delays, the deadlines. We've been requesting the deadlines to be extended till 2022. Now in supporting like broadband, it's a critical element that's needed. However, in order to obligate these monies to contracts, to get service providers to come out to the public land and complete their necessary job by December, it's a hardship. It's causing detrimental stress upon all of us. Yeah, there's various opportunities provided through the CRF dollars, but yet, as our internal procurement policies, accounting policies dictate, we got to get 3 bids, and you got to go out. That takes time, and then now we're running against the time clock to really fully expend the dollars by December 31st. So we're trying to figure out ways on the House and Senate side to ask for extension of these dollars into next year or the following year. And that's very critical to help us to fully support and build up capacity and capabilities within our communities here in Pueblo Country.
Thank you. I just signed off on a letter to the administration this afternoon to advocate exactly for that, the extension, and also to be able to use some of those dollars for lost revenue. I had a second question, but I'm so interested in one of the questions that Congresswoman SHARICE Davids was going to ask you that I want to ask it for her. She put in the comment, she's hoping to hear about making sure that we have an equitable distribution of the vaccine in Indian country when that vaccine is available and to us all. So does anyone sort of have any thoughts on what programs or what work we can do in this Congress to make sure that we have an equitable distribution of the vaccine when it's available?
Yes, I think early and direct engagement with tribal nations to really understand the need in Indian country. It was very clear when the pandemic began that those outside of the United States understood and recognized that the scale of this pandemic could likely exceed public resources. And so what we're seeing in other parts of the world, as well as here in this country, it's requiring public-private partnerships just to deliver basic things like testing, for example. And so knowing that that's a reality that we could potentially be facing, early and direct engagement to understand the full scope of the need within Indian country, and then working with us to close that gap in that need by one, upholding the trust responsibility to provide the funding, two, support tribal sovereignty in our way of securing the resources, both domestically and internationally, to close that gap. And so it's simply those two things, but I would strongly encourage Congress to directly engage with tribal nations and undertake a study of the need.
And Representative, in my comments I had mentioned, because of Pueblos and other Native American communities for many health disparities, that we should be priority for vaccines. I believe I heard from Navajo Nation president that they are in line for getting those vaccines. But again, all Pueblos, based upon the trust relationship and responsibility, not based on race, but based upon the political status of us as political government, is essential. A couple weeks ago, the All Pueblo Council had a meeting with Deputy Secretary Hargan as they visited our clinic here in Santa Fe. And so that was the thing that we did mention. I can also share you my discussion point that I posed for that session, because it's very important now that we don't advocate for all of Indian country, we're going to get left out. And that's what we don't want. And so again, it's not, that relationship is very critical. How do we engage with the administration and Congress based upon that relationship, which is very essential, and because of the high health disparities we face, diabetes, hypertension, blood pressure, all of the people have that high risk of contracting the COVID-19, to include now the flu.
Thank you so much. I suspect my time is about done, so I just want to say thank you for joining me and turn it back over to Chairman Jeffries.
Thank you very much, Congresswoman Craig. And again, I want to thank our distinguished panelists for your leadership and your insight and your participation. And I did want to ask a question of each of you. The COVID-19 pandemic has, of course, exposed underlying societal disparities that exist amongst communities of color, immigrant communities, and Indian country that pre-existed COVID-19 and have been exacerbated by the pandemic. And we, of course, are going to need to intervene forcefully. As I indicated earlier, make sure that the data drives the resources, and that certainly means resources to Indian country to get through this turbulent moment in connection with the pandemic. But I don't think we can return to normalcy, as some have talked about, because normalcy for Indian country is still problematic in terms of the underlying inequities that existed. And so I'd be interested in your perspective as to how we get to a new normal post-pandemic. What should we be thinking about to make sure that those who live in Indian country have the capacity to really experience all of the opportunities that this country should offer for everyone?
Yes, thank you so much, Chairman, for that question. I would offer two suggestions. The first is to recognize that there's a tremendous wealth of wisdom and knowledge within each and every tribal nation. And when we consider a public health care recovery plan for Indian country, I think it's important to honor that sacred body of knowledge that every tribal nation has, and ensure that we have resources to envision our own recovery with traditional medicines, traditional foods, food sovereignty, those things that are so important to building our strength, our resilience, and that better future so that we come out of this pandemic stronger. I would also suggest upholding the treaty and trust responsibility, as we've said throughout this testimony, but understand that there are real barriers when the trustee does not uphold that responsibility, and while at the same time not honoring and respecting tribal sovereignty. So when we have our own vision, we're still severely oppressed economically and politically. And so it's just two basic functions: fulfilling the trust responsibility, and when you're not going to fulfill that, at least get out of our way so we can exercise tribal sovereignty and envision that brighter economic future and that brighter public health future that abides within each and every sovereign nation. If we just had a trustee that would do two things: respect and honor.
Thank you, Madam President.
Thank you, Chairman. This is Governor CHAVARRIA. And for public country, it goes back to the power of prayer. Maintaining our traditional, cultural, religious beliefs in the power of prayer throughout time since the 1540s as the first contact with the Europeans, we remain resilient. But that goes back to our traditions, our culture, religious, and most important is our native language. That's very important. We are capable, we are knowledgeable, we understand the needs of our communities, and yet we have economic portfolios that have diversified. But yet, in order to fill in those gaps in the federal state funding, it's very important and essential. How do we strategize, really figure out how do we provide adequate healthcare? How do we provide adequate education? How do we provide employment? How do we create the workforce for the future? And so it's very important working together to really figure out a strategy of coming together to fully understand the commitments we have at the federal level, but also at the tribal level. Our prized treasure, which is our elders, have taught us many things. Now we teach that to our children because we can't forget, number one priority, who we are, where we come from, living off that land, utilizing that resource. It is our grocery store, our pharmacy, our biological classroom, and that's very important. But now in 2020, we live in two worlds. So living in these two worlds, you must have to have a good income to support a home, to buy a car, to buy food, to buy groceries. But what's critically important is how do you intertwine our traditional cultural religious aspect, which is also education, into the mainstream society's concept of education to formally figure out what are those strategies to remain resilient and face these challenges and obstacles in our time of our life. And this pandemic has caused us and wants us to separate. We can't have that separation. Create that bond, that strength to still remain as one, which is done through respect. We say is gang. So honor and respect is very important, no matter who we're at. Face the challenges, and it's not a one size fits all, as we're all sovereign governments dealing with this together. But with your efforts, with Congress's efforts, we can fully support this in a positive outcome and solution. But it calls for additional dialogue, conversation, and commitment on all of our parts moving forward. So thank you for the time, Chairman.
I'll
Thank
respond
you.
really briefly. Oh,
Yes.
okay. Yeah, I'll respond really briefly, and then I have to unfortunately jump to another commitment. But thanks again, everybody, for the opportunity, and particularly to the chairman for such a great question. The former vice president has stated a commitment on the campaign trail that he's going to invest 40% of his Build Back Better agenda into the communities most impacted by poverty, pollution, and climate change. 40% of $2 trillion is a lot of money. That's $800 billion. And that begs the question of how we identify the communities that are most impacted by those things that would be prioritized for investment. The federal government has a couple of tools to do that. One of them is called EPA's EJ Screen, but it needs to be updated to be up to the task of screening and identifying and mapping those communities. And there might also need to be new initiatives that are looked into, maybe cross agencies to identify areas of need for investment. And I think in particular to tribal communities, there are specific questions related to our sovereignty and data about us that are quite unique. And while they parallel many of the needs of communities of color, they are in fact distinct, and they need to be done in a government-to-government relationship to tribes, as I'm sure President Sharp and the chairman would certainly agree about that. And so I think that it's really important that we are starting to think about those challenges right now, because the election's coming soon. 2021 is coming really soon, and these communities and our tribal nations needed that recovery and that support, not just yesterday, but many years ago. So that again, thank you so much for the time, for the really thoughtful question. And I really appreciated also listening to what the co-panelists have said. It's really heartening to at least know that people are thinking about and discussing these very pressing challenges.
Well, thank you so much. And I think you all in different ways have touched on the concept of respect and making sure that we operationalize that respect for sovereignty, as well as being respectful of the trust obligation that exists. And that respect means dialogue plus partnership plus empowerment, so that you are equipped with the resources to make sure that life can be lived abundantly in the manner that you have envisioned, in a way that applies equally to those who live in Indian country, regardless of zip code, as for far too often been the case here in the United States of America. So thank you for your engagement, and I yield back to Congresswoman Haaland.
Thank you very much, Chairman. Very honored to have you here. Well, it's just us three. So I have a question for the both of you, and look forward to your answer. President Sharp, you brought up a new bill that I'm working on to introduce, and it's called Honoring Promises to Native Nations Act. If you had to highlight the most critical federal funding shortfall for tribal health what would that be? And that's a question for both of you, but President Sharp, if you'd like to answer first, I'd appreciate that.
Yes, absolutely. And I cannot tell you how much I appreciate that question. I've asked tribal leaders this hypothetical. I've been in a room full of tribal leaders, and I've said, how many of you have had a relative or a friend that's gone to the clinic, and they get sent home, their condition worsens, they go back to the clinic, they get sent home, then they go to a hospital off the reservation, and it's critical. And I have a friend of mine that I grew up with in grade school, had double pneumonia and passed away at 47 years old. And when I've asked how many of you have had that experience, every tribal leader raises their hand. And I pose that hypothetical to make this point. Outside of a reservation, there is a comprehensive healthcare delivery system that not only includes funding for doctors and pharmacists and those things that we see in IHS clinics, but it also includes mechanism for quality of care, access to care, certifications and board around quality of care. But we don't see that level of a comprehensive system within Indian country. And so there's, with regard to medical standards, I challenged other tribes, under tribal law, do you have a code that says if you're going to practice medicine within our reservation, these are the standards of care? We don't have that level of thought or service delivery for a healthcare system. So I would strongly encourage the first thing to close that equity gap is to really undertake a study of what does a comprehensive healthcare delivery system look like off the reservation. And if we get to a place of fairness and equity, it's that same system that should be translated so that our citizens get the same amount of care, whether they're on the reservation or off the reservation.
Thank you so much, President Sharp. And Governor Chavarria, what would, if you had to highlight the most critical federal funding shortfall for tribal health, what would that be?
I will feel that's qualified healthcare providers. And so for Pueblo country in New Mexico, we are all served different from the Indian Health Service. Some of us are still direct service tribes. Some of us are Title 1638, and some of us are Title 5 self-governance. And what's unfortunate is the tribal share, the funding formula that's associated with the numbers of their people. And so if the numbers for my community in Santa Clara are low, we have no opportunity to either go into Title 1 or Title 5 of self-governance. But what really critically needed is healthcare providers, qualified, professional, because we don't have that today. And in the national stockpile, that's very important because we've got to prepare ourselves. Now there's not no funding available to provide these critically needed resources to our communities. Who's going to suffer? It's our people. And so for a number of years, I know all of us in the country have advocated Congress to adequately support the Indian Health Service. We appreciate the monies that's come down, but this goes back to Chairman Jeffrey's comments before the pandemic. This was even before the pandemic for a number of years, where Congress hasn't fully fulfilled its trust treaty responsibilities to obligate and appropriate additional funding levels to provide these much needed critical healthcare needs of our community. Unfortunately, I got, labeled as a type 2 diabetic. So I fully support the special diabetes program, which is very critical because now I fall into that category of high risk for contracting this COVID-19 virus. So all this is very important of utilizing our personal health disparities in relation to the real life scenarios that's going on that we see day to day within our healthcare system, no matter where it be throughout Pueblo country or even Indian country. So that's very important, is providing adequate appropriations, but we need proper and adequate healthcare providers to help us along the way. Without that, we're going to still be hurting for years to come.
Thank you. Thank you so much for your questions. What I'd like to do, I have one last quick question, and Sharice Davids also wanted to know, with respect to her work on the Small Business Committee, she wanted me to ask the panel to speak to the economic development support they can be working on. So is there anything with respect to the Small Business Committee that you would put forward, an idea or what they should be thinking about as they're moving through their committee?
I would suggest one of the recommendations I would have in this, we have a lot of entrepreneurs within our communities that have a great deal of vision, but access to capital still remains to be a significant and a major barrier. I'm aware of individual development accounts, IDAs, and I know when Congress has adopted IDAs and authorized those in the past, it's been through states. So unless a tribe can either get certified through a state or partner with a nonprofit, our tribal members don't have access to a tribal IDA program. And to me, it seems like if there was an investment in that, we would be able to provide the initial access to capital for many of our entrepreneurs to get started. And so that's one of the areas where here at Quinault, we see a major barrier.
Mm-hmm. Thank you. Governor?
Yes, Representative. And so that's also a critical point because many of our people are artisans. And right now, because our public still remains closed to the outside, they're hurting financially to pay their bills, put food on the table, to buy clothes for their children. And so there has to be some kind of funding mechanism available to assist those individuals that make the pottery, that make the baskets, that make the moccasins, that make the attire. And so it's very critical. How do we support them? The tribal government, we don't give out any per capita payments. So it's very important. How do we then leverage with other opportunities such as that paycheck protection program or other mechanisms that might be available through Congress to support those individuals because that's their daily employment income. And so it does cause a detrimental impact on them to support their family, especially during this time. But after we get out of it, how do we food support them to expand their workload to help support them to be sustainable into the future?
Mm-hmm.
And we stand to help each other.
Thank you. Thank you both so much for being here with us today. We're honored to have you. This is not our last conversation, as you well know. This is an ongoing conversation that we are always happy to have as a member of Congress. On behalf of the Democratic Caucus, I thank you so much for joining us today, and have a wonderful evening.